Update and overview of the obstacles that existed when this crisis began as context for the improvements that we've made. For the 5 weeks from the beginning of March and running through April 4th, IDES saw more than 513,000 initial unemployment claims filed, the largest number ever filed over any 5-week period in our states. That's more initial claims than during all of last year. And it's a 400% increase above the total initial claims in the same first 5-week time frame of the 2008 Great Recession. Remember that the computer system that was built to handle unemployment claims for our state was built in 2010 in the wake of the Great Recession, and it was built with the idea that unemployment would never really exceed what we saw in 2008 and 2009. But today, we are seeing 5 times that number of claims. For some additional context, since March 1st, IDES fielded over 6.5 million online sessions, and the IDES call center, operated by 173 employees, has processed thousands of calls each and every day. We're not alone. As states across the nation continue to struggle to keep pace. Here in Illinois, we've assigned hundreds of state employees to work around the clock to respond at the fastest rate possible. 539 IDES employees bravely return to their physical workspace each day to answer calls, process claims, and provide support. And since March 1st, they have collectively worked 6,500 hours beyond their normal workdays. They processed and paid over 270,000 new claims, totaling $200 million in unemployment benefits. These IDES employees did in a month what might normally take most of a year. To increase staffing during this surge, IDES has brought back retired staff members who left the field fairly recently. Because some retirees may be in a COVID-19 vulnerable category, to keep them safe, IDES is providing them with laptops and giving them assignments that allow them to work from home. We've also updated IDES's phone system to increase capacity by 40%, substantially reducing wait times. We also expanded daily call center hours to respond to high volumes after hours. And to expand that capacity further, IDES is establishing an outside call center with an additional 200 agents, all from Illinois, who will assist in the application and certification process. Online, the web platform has been entirely overhauled. The system has been moved to new hardware infrastructure, significantly increasing capacity. Load times for web pages now average less than a second. The agency has also sped up the application process by removing some of the normal verification checks that were slowing people down, replacing them with faster methods. And like other states, we implemented an alphabetized filing schedule to spread out the volumes of claims and provide all who are filing an easier and faster process. Weeks ago, we brought in outside partners, including Accenture, IBM, Pitney Bowes, and Deloitte, to work alongside us to significantly expand our web capacity and capability while adapting to recently passed programs from the federal government. They're doing in weeks what normally would take a year. And in partnership with Google AI, with Quantify and Carahsoft, we've developed a 24/7 service on the IDES website to provide immediate assistance to filers with their frequently asked questions. This program is rolling out this week. We're also hard at work to expand unemployment benefits themselves to more people who were previously ineligible and to increase payments to every eligible unemployed Illinoisan. As I announced last month, I signed an executive order to waive the traditional delay of a week before the collection of benefits, allowing our claimants to receive 2 weeks of benefits instead of 1 in their first payment. Additionally, last week was the first week the Federal CARES Act allowed for the payment of the additional $600 a week in federally funded benefits from March 29th through July 25th. And I'm pleased to say that we have fully implemented this program with first payments already out the door, making Illinois one of the first states to get this extra support into the hands of our residents. I want to review the new program of unemployment benefits for independent contractors, a badly needed relief for so many. After Congress passed the CARES Act, the U.S. Department of Labor attempted to limit this program by creating real regulatory obstacles for implementing it. It has taken U.S. Department of Labor weeks to issue guidance to the states, and they've promulgated confusing and very stringent regulations that attempt to severely limit who can actually qualify. After expressing our frustration about this to the federal government, IDES has contracted with an outside firm to help us stand up a new system to get these benefits to as many Illinoisans as possible, despite the labyrinthian regulations. In the coming weeks, 1099 workers, including independent contractors and sole proprietors, will be able to get unemployment benefits, with payments beginning to go out around this time next month. I want to turn your attention to those on the front lines who are fighting this pandemic, who leave home to go to do their jobs every day and come home carrying worries and fears about what happens to their livelihood if they get sick. These are our police officers and our firefighters, our healthcare professionals and support staff, our grocery workers, our transit employees, our truck drivers, all of the people who provide the critical services that keep us going under this stay-at-home order. We owe them a debt that we can never fully repay. But to start, we can give them the peace of mind to know that they will be covered if they fall ill on the job. So I asked our Illinois Workers' Compensation Commission to pass emergency rules to protect these heroes by ensuring that their workers' compensation insurance covers them if they contract COVID-19 while they're on the job. And just this morning, the commission voted to support this extension effective immediately. I'll continue to do everything in my power to get our residents the support that they need to get through this battle. You know I will. I'm fighting hard, and we've got many weeks forward that we're going to be working hard to lift up our working families and to get the state back on track. I thank you all, and I now would like to turn it over to our IDPH director, Dr. Ngozi Ezike, for today's medical update. Doctor?
Good afternoon. In talking about unemployment, it's important to recognize and acknowledge the toll that it takes on individuals as well as communities, not only financial, but mentally and emotionally. Unemployment has been linked with a number of psychological disorders, particularly anxiety, depression, substance abuse, and a decrease in self-esteem. Workers' compensation can help with some of the financial impacts, but I'd also ask that we also support each other with the societal and emotional impacts. During these tough times, I'd like to remind people of the resources that the state launched on Saturday. It's Call for Calm, a free of charge emotional support text line where you can speak with a mental health professional. Text TALK, T-A-L-K, to 55020 or hablar, H-A-B-L-A-R, for service in Spanish to the same number, again, 552020. Today, IDPH is sad to report that 74 additional lives were lost to COVID-19, to bring our statewide total to date to 794. We are also reporting 1,173 new COVID cases for a total of 22,025 in 87 counties of Illinois. The individuals and the communities impacted by this virus have touched nearly every part of our state. We must stay the course and continue working together to practice physical distancing and stay at home as much as possible. This, along with wearing our masks and washing our hands and cleaning the frequently touched surfaces, are absolutely our best weapons against this virus. As we move forward, let's all be aware of the very real impacts of unemployment and help our fellow Illinoisans. Once we emerge from this pandemic, we will continue to rebuild all of our communities. And now I will translate my comments into Spanish. Buenas tardes. Hablando sobre el desempleo, es importante reconocer el costo que afectó tanto a las personas y las comunidades, no solo fiscal, sino también mental y emocional. El desempleo está relacionado con enfermedades de salud mental, particularmente ansiedad, depresión, abuso de sustancias y una disminución de la autoestima. La compensación de los trabajadores puede ayudar con algunos de los impactos fiscales, pero me gustaría pedir que también nos apoyemos con los impactos sociales y emocionales. Durante estos tiempos difíciles, me gustaría recordarle a la gente los recursos que el Estado lanzó el sábado. Es Llama para Calma, una línea de texto de apoyo emocional gratis donde puedes hablar con un profesional de salud mental. Envíe la palabra hablar para recibir servicios en español al número 552-020. Otra vez, 55-2020. Hoy, IDPH reporta 74 vidas adicionales perdidas por COVID-19, para un total de 794 muertos aquí en Illinois. También estamos reportando 1,173 muertos por un total de 22,025. Las personas y las comunidades afectadas por este virus han tocado casi todas las partes del estado. Debemos mantener el rumbo y seguir trabajando juntos para practicar el distanciamiento físico, lavarse las manos y quedarse en casa cuando sea posible. Y no te olvides de usar su máscara. A medida que avanzamos, todos seamos conscientes de los impactos muy reales del desempleo y ayudamos a nuestros compañeros de Illinois. Una vez que salgamos de esta pandemia, vamos a reconstruir todas las comunidades más fuertes que antes. Gracias. And with that, I will turn it over to Ms. Alice Johnson, the Executive Director of the Illinois Nurses Association.
Thank you, Dr. Ezeki. In normal conditions, hospitals are one of the most hazardous places to work in America. Registered nurses lift, reposition, and transfer patients, which can cause overexertion, sprains, and strains. In Illinois, the on-the-job illness and injury rate for nurses is 7.9 per 1,000 RNs. These are not normal times, and nurses not only face these hazards, but are now on the front lines of the fight against a deadly pandemic. Every day, they go into work risking their own health and safety, as well as the safety of their families. More than 200 doctors and nurses across the world have been lost to this pandemic. In Illinois, nurses in hospitals, long-term care facilities, clinics, mental health centers, and correctional centers go in every day to take care of their patients facing this same risk. As a result of their sacrifice, nurses in Illinois are starting to get sick and infected. Sadly, we have seen some employers argue with nurses about where they became infected, completely ignoring the obvious risk created by the work they do every day. Nurses should not be left to deal with the long-term and costly consequences of becoming infected with COVID-19 on their own. On behalf of the Illinois Nurses Association, we want to thank Governor J.B. Pritzker for making this important change in the law to see that nurses and all essential workers receive their rightful benefits under Illinois' workers' compensation law. Due to this change, there will now be a fair and reasonable presumption that a nurse who becomes infected with COVID-19 during this crisis became infected on the job, which will then ensure that she receives the workers' compensation benefits that are rightly deserved. Again, thank you on behalf of the nurses of Illinois. And now we'll hear from Chuck Sullivan, the president of the Associated Firefighters of Illinois.
Thank you, Alice, and good afternoon. In a crisis, we need a decisive action, and I think we can all agree that Governor Pritzker has demonstrated that decisiveness regularly over the last 5 or 6 weeks, and today is no different. The Associated Firefighters of Illinois represent over 15,000 members in 224 communities across the state, and we are all very thankful for this amendment. Firefighter EMTs and firefighter paramedics are the first link in the public health system, especially as they protect their communities during this pandemic. We often respond to uncontrolled environments on a daily basis, and that's created a unique set of exposures during this public health crisis. But you can be assured that we have been and will continue to provide prompt professional care when we're called upon. And over time, the term fire department has become more of an all hazards department. So whether it's a motor vehicle accident, an apartment fire, a hazmat leak from a rail car, an asthma attack, or you're stuck in an elevator, we'll be there for you. And each one of us took an oath and swore to protect the members of our community. It's comforting to know that through this emergency amendment of the Worker Compensation Commission, that the state of Illinois will be there for us. I also want to thank leaders Jay Hoffman and Kathy Willis, as well as Deputy Governor Dan Hines, who advocated on our behalf to ensure that our members are given the peace of mind, knowing if they are sickened, they are taken care of. So thank you. I'd like Governor Pritzker to return to the podium for questions and answers.
Thank you very much, Chuck. Thanks very much, and I'm happy to take any questions from reporters in the room.
Hey, wait. Can Marianne go first because she's got the mic, and then we'll give it to you?
Okay. Yeah. Marianne.
Thank you. All right, no, it doesn't matter. I just wanted to check. Could you explain on the independent contractors, what do you mean by that next month? So what about all this time that they haven't been able to work? Are they able to collect for that as well? Could you just give it a little more detail?
Yes, they have to be approved. They'll get paid for the time that they're not working, but the process of going through as an independent contractor is one that is new, and in order for us to qualify them, to make sure that we're doing it in the right way, and of course with these changing regulations by the U.S. Department of Labor, it's going to take us, a few weeks to stand up that new system.
Could you also update us? I know you were asked yesterday about this, but now we've learned that a poll worker died on the South Side literally 14 days after the election. Should the election have been held?
As you know, and I've said this before, the governor of Illinois does not have the constitutional right, legal right, to shut down the election here. It's different in different states. We don't have that here. So I couldn't shut it down. What I did do, though, as you recall, is in the weeks before the election, I began virtually every day, or certainly frequently, telling people, you can vote today, early voting. You can get a mail ballot today, send in and get one. We were encouraging people not to go to the polls if they could avoid going to the polls. And indeed, I think that's exactly the same thing that we need to do, even more so when we get to the general election. I'm advocating that everybody should be applying for a mail ballot if they can, and that's virtually everybody, and to vote by mail.
Was it a mistake? I mean, it does, 5 days after the election, now people are getting letters. They're going to be concerned that they were also infected.
Yeah. What I can say is it's, as you know, a decision that gets made by the legislature, whether there's an election on a given day, avoiding having people go to those polling places, making sure that there was sanitizer and that there were masks and other things that people needed, the PPE. That was the job of the Board of Elections, and they were promising to do that. And it is horrific. This virus does not know any boundaries. There's no doubt about it. And that anywhere you go, it is possible to pick it up. And as you know, even then, we didn't have a stay-at-home order in place, even though we were the second state in the United States to put one in. In March 17th, we didn't have that in place. And it wasn't at that time something that, everybody thought, well, this is the right thing to do. 4 days later, we did put it in place.
Republicans held a news conference as well this morning, very concerned about this same issue of unemployment, said that really you've dropped the ball, there should have been more people, they could have been quicker. Do you think you now have it in place to help people faster?
We have been working since very early on as the onslaught of this pandemic was upon us, and we knew that there were going to be unemployment claims to a greater degree than anybody ever expected. And we began working on this, on upgrading the systems, on bringing in people who otherwise weren't coming into work, making sure that we were recruiting others to answer phones and so on, expanding our phone lines. I would say that this is still a work in progress. There's no doubt about it. It's much better than it was. Much better than it was. I also want to say that that this pandemic, this COVID-19, knows no partisanship. And in the process of my work here on dealing with COVID-19, I've had lots of interactions with Republicans and Democrats. Many have been extraordinarily constructive in their offering ideas and assistance and the things that we need. Some not so much. And I think that, I draw a distinction between those who stand up in this moment and try to help and those who, hold press conferences to complain.
And folks have asked me where you came up with the list for the workers' comp on who's essential and who's not, and why is the news media not a part of that? Why is the media not part of if someone from the news media got sick, could not claim workers' comp?
Well, so let's start with the essential worker list is something, overall, the essential worker list is something that came from the Department of Homeland Security originally.
And news media is part of that.
They are, yeah, that's right. And so we've added, we've created a list that's even larger than the Homeland Security Department put out. With regard to workman's comp, we started with what we thought were the people who are very much on the very front lines, the people who are interacting literally daily, potentially, with someone with COVID-19. They're treating, think about a nurse in a hospital right now. I don't think there's anywhere that you could be a nurse right now in the state of Illinois that you're not in some fashion interacting with a person who is, has COVID-19 or potentially has COVID-19. And the same thing for the folks, the firefighters. Think about what they do. Just listen to the list of things that Chuck said. So, look, is it something that the Workman's Comp Commission could consider, expanding to other areas? Yes, but we felt like the people who are on the very front lines, most exposed, those are the people we wanted to make sure got covered first.
Understood. Any update on McCormick Place?
I'm very proud to tell you that the people who have done the work there deserve such kudos for the amazing results that we've seen. Now, one of the things that we've got at McCormick Place I want to describe to you that's different than the original reports that were coming out. There are 500 beds you're aware of that were, are low acuity people with COVID-19 who can move out of a hospital. There also is another hall that's been set up with tents with negative pressure, which is hard to do inside a pre-existing building that doesn't have negative pressure normally. But that was set up by the National Guard. The National Guard flew their C-130s to go pick up these tents that are, housing this negative pressure wing of McCormick Place, and that's 750 beds, potentially for people who might come in as low acuity. It's possible they might, reverse course and become worse and need to move within the facility to kind of a more acute phase. So that's what that is doing, and it's a really remarkable thing. We also have central line oxygen in this facility. That's not something they have at Javits Center. So the idea that we're able to provide oxygen to every one of those patients, and the kind that doctors would say, that's a higher acuity kind of bed that I want to put somebody in, that's really remarkable.
When might you accept patients? When might McCormick Place?
Well, there isn't a date. I mean, I would tell you this. We're monitoring very closely the hospitalizations, the ICU beds, the vents that are being used in hospitals today. And you've heard already that, there's a bending of the curve, that things look, better in terms of the angle of ascent than they have been before, even in the numbers today, although the deaths are more than they were yesterday. As you see, if you look back over the course of 6 days, there's a kind of a leveling effect, right? We've had days that are above today's, days that are below, but there's a leveling effect that you can kind of see in those numbers, and more so even as you look at the numbers of new cases. Really looks like there's a leveling there. So, when we look at all of that, and then we see, well, when does someone transfer out to McCormick Place? It's really when the hospitals become full. And they're not yet full. Indeed, you'll hear, because we're going to talk about hospitalizations a little later this week, that we're going to be focused on, we are focused on hospitalizations and ICU beds, because that tells you what direction you're going and whether you're going to have patients moving over to McCormick Place. Right now, we don't have any need, but we prepared it for the possibility of needing it, and as I've said before, I pray that we don't need it.
Is it President Trump's decision to end the stay-at-home order in Illinois, or is it your decision?
Well, I think he's going to issue some advice about it, but it is true that it's up to the governors to make decisions about the executive orders that we've put in place, and all of the governors that I've talked to, and especially me. We want to lift these orders as soon as we can. We want to get things back to more normal as soon as we can. But one thing that we have to pay attention to is, what direction are these curves going, and what is the advice that we're getting from, again, the scientists and the doctors who know more about immunology and about all the issues of COVID-19 than an elected official who's not a doctor.
Well, she got the one question that I was going to ask, but that's fine and dandy.
I'm sorry.
The other question I wanted to ask you about was closing schools. As you're well aware, following what other governors are doing in New York, they decided to go ahead and close schools for the rest of the school year. There's a lot of people out there wondering, are we going to reopen schools, or are you going to go ahead and close them down for the rest of the year and do e-learning?
I promise I will tell you as soon as I know the answer to that question.
Is that coming this week?
At this moment, I can't tell you whether it's coming this week. What I try to do every day is when I get into the office, we look at where are the numbers, what direction are things going, what would life look like, afterward, if the direction is the right way, the correct way, and make decisions on that basis. But we haven't gotten there yet.
Is it likely that we're going to lift the stay-at-home order by May 1st?
I think it's likely that there will be adjustments to the orders that we've put in place, but it is also true that, as I said yesterday and I've said the last couple of days, that it's not like we're anywhere near herd immunity, and there isn't a treatment. And in order for you to get to a point where you want to start moving significantly back to normalcy, you need widespread testing. We don't have anywhere near widespread anywhere in the country. There's no widespread testing, but we're doing more and more and more every day in Illinois on average. You'll see that going forward. The second is you need a contact tracing system that truly allows, when you detect somebody as COVID positive, that you can get a hold of the people that they know that they came in contact with in the last 14 days, let's say. And then the last part is like I said, you need a treatment to lessen the severity of the symptoms that people experience, so that either fewer of those people go to the hospital, fewer of them move from just a plain regular bed to an ICU bed, hopefully many fewer moving to a ventilator, and of course, getting the death rate down.
And of course, obviously, with all those points that you just made, it doesn't seem like it would make any sense to put all these kids back into schools in a group setting to potentially expose them if we can't do the testing and all the things that you're saying you want to do.
I think nothing that happens, next month or the month after that is going to be exactly the way it was 4 months ago or 5 months ago. And so the question really is not, could you do this or that? The question is, how would you do it, practically speaking, so that you don't have many more people getting infected?
So to follow up on that, what are some of the conversations you're having about how you make that happen? I mean, do we open the economy, so to speak, in phases, or is this something that's all at once? What are the conversations, and what are that you're having, and what are the experts telling you?
So there's not exactly a perfect consensus, right? But you've laid out some of the things that we're talking about, which is, what is a phase? I mean, we talk about phases. Well, what does phase 1 look like? Forget about 2 or 3 or 4. What is the first thing you do? And how does that work? What rules do you have to put in place? Does everybody wear a mask? Do you require that? That's, today I've encouraged everybody, the CDC's encouraged everybody, but there's no requirement that people who go out in public must wear a mask or go into a grocery store or anywhere else. So that's, a question. What are all the rules for each industry? That's the other thing. As you start to talk industry by industry, a manufacturer is very different than a clothing store. What are the rules? Do we have to start thinking, the way that that the fire marshal determines how many people can be in your store, in your grocery store, based on the number of square feet, so that if there's a fire, everybody can get out? Do we now need to have a public health administrator determining, how many people at any given time can be in a certain store for us to reopen those stores?
And are those decisions that are going to be made over the next 2 weeks before your current stay-at-home order expires?
Well, you couldn't make all of those, there's no doubt about it, but I have been talking to industry leaders and people who lead workers in those industries, because the most important thing is safety and health. I mean, we have to start with that as some basis of understanding between businesses and workers, that if people are going to go back to work, or if we're going to open up, opportunity for people, back in their industries, will they feel safe? Because it's very important to feel safe and to actually be safe. And that's what we're trying to work on. And again, it's going to be, you talk about phases, we have to look at these things very much industry by industry, and then ask the question, so and when does that change too? How long do you go? What is the gating issue? I told you what the gating issue is for any significant moves here, testing, tracing, and treatment. And then, I think more PPE availability. And then what's the next phase? I think the next phase is a vaccine. But again, I'm trying to listen to the experts. And, I was a businessman before I became governor. I understand the challenges businesses are going through. And I'm also very concerned to make sure that the workers who go back to work are safe. So those are things that I'm spending time on.
Mayor
The
Lightfoot
last
said
question in the room. and then
Mayor
we'll go
Lightfoot
online.
said this afternoon she expects that stay-at-home order to be extended. Can you give people any idea when you can confidently say if it's going to be extended, or when you might know?
I can't tell you now, because I don't actually, there isn't a date that I have in mind for it. Things have to evolve. Every day I wake up, I come into the office, and among other things, I wait for the numbers. And a lot of what I hear from Dr. Zike is what guides me. And I, try to check in with the epidemiologists and others around Illinois, because we've got some of the best in the world, and make sure that there's a kind of a consensus, of where are we right now. And so I will tell you that there's a building consensus anyway of people in hospitals, of epidemiologists, of our public health director, that things are, again, I've said it many times, but things are leveling more than they have before, and that's a very good development. You want to see that curve continue in the direction that it's in, and the reason that it will continue is because people stay at home under this order right now.
All right, questions from online. Tim McNicholas with CBS Chicago. Starting today, independent contractors in Michigan can apply for unemployment benefits. Some gig workers are wondering why the same can't be done right now in Illinois. Why is it taking longer here, and when will Illinois workers be able to apply?
Well, the federal money that comes to support that new independent contractor support doesn't come until, you've got until May, frankly. And so we've got to make sure that we've got a system that determines who's eligible and who's not before we can distribute money that isn't here yet. But I will tell another thing. I mean, some states, by the way, have gone ahead and taken something they've got in their own coffers and offered that to the gig workers and independent contractors. But that's not something that's available to us in the state of Illinois.
This is from Hannah Meisel. Governor, you characterized the emergency rules approved by the Workers' Compensation Commission this morning as rules that covered essential workers if they're infected by COVID-19 on the job. However, the actual rules don't read that way. They say all workers deemed essential by your executive order who come down with COVID-19 will be rebuttably presumed to have caught it at work.
Yeah.
The employment community says that this is not only an egregious overreach, but also illegal because they argue such a large change can only be approved through legislation. Is that what was intended?
Look, my intention is to protect the workers of Illinois, the people who are most affected by this COVID-19. We are in a pandemic, in an emergency. This is what we need to do right now to protect people.
Lynn Sweet from the Chicago Sun-Times asked, will the program be fully implemented by the week of May 11th? Does that mean implementation, or people can start to apply in May?
That's a great question. I'm glad it got asked because I want to clarify. People can apply now. They can send in their application now. It will be determined to be either eligible or ineligible for the current system. And if it's ineligible because it's an independent contractor or 1099 gig worker, that person's application will then move to being ready to be processed by the new system that'll be stood up and ready to go in early May. Or early mid-May.
JB Monks with the Chicago Tribune. Are you considering shifting state workers from other agencies to IDES to help meet the demand for unemployment filing? And what do you say to the unemployed Illinois residents who have been trying for weeks but haven't been able to get through to file claims?
Well, the answer to the second half is everything I just said when I stood up here and told you what it is that we're working through here and all the challenges that we've had. As to moving workers from other departments, I want to explain that there are federal rules that apply to those who take unemployment applications, those who are responsible for taking your unemployment application at IDES. They have to be trained in a certain way. This is sensitive information for individuals, and so that's why you can't just grab people from anywhere, and why we're making sure that the people who are working the call centers, the people that are working at IDES, remember, what did I say? I said we're bringing back retired workers. They've all been trained, and so they're doing it from home, but the point is that they're eligible to be able to do this right away. And so we have expanded the workforce at IDES to take those applications by phone and to help with the applications online.
Rebecca Broomfield with WMBD in Peoria. We've received a copy of the cease and desist notice sent from state police to the Pekin Country Club. Why the follow-up notice, and what do you hope is the outcome from that push?
I can't give you a specific answer to the question, Rebecca. State police are ultimately responsible for enforcing the stay-at-home order and all of the executive orders that we put in place that would interact with the public. So, that's why the state police are involved.
This is from Greg Bishop. Being that it's been stated that COVID-19 is no one's fault, how do you balance the extra cost employers and even taxpayers that pay for first responders could bear with this emergency rule from the Workers' Comp Commission?
Well, what I can tell you is that in the middle of an emergency, the only way that you have to operate is to protect people as best you can, their health and safety, and to the extent that it's required that someone has to pick up the tab for that sometimes that will fall on the people who are most able to pick up the tab. Having said that, we have challenges with our unemployment insurance in the state. Every state does. Indeed, that's why we're talking to our federal officials about making sure that they're going to help us replenish that unemployment insurance trust must, because it's happening everywhere in the country, and to a greater degree or lesser degree to each state. But every governor that I've talked to has said they're going to need help.
Shia Politico will be our last question. The Supreme Court is hearing arguments by phone, and the Chicago City Council is planning a teleconference. What is the holdup with the state legislature?
Why aren't they meeting? Is that the question? Well, it is unfortunately a fact of state law today that the state legislature cannot meet electronically or in any way other than in person. That doesn't mean they couldn't meet and then decide not to meet and instead have a meeting by Zoom or some other method, but that is not currently state law. In order to change that, you'd have to have a meeting of the legislature. So, I know that the leaders on both sides of the aisle are having some discussions about how they might do that effectively. We're certainly going to assist them to make sure that it's a method that's safe and healthy for all the legislators. I don't know when that will be.
All right, thanks, everyone.
Thank you.